Welcome in this new episode of Newsroom, News in Research in Occupational Environmental Medicine. Today, in this March-April episode, the editors of Scandinavian J Work Environmental Health published a short but interesting editorial on a perspective after 1 year of COVID. They give some interesting element of work consequences and identified some priorities of research agenda on COVID-19 and occupational health. First, identification of occupational higher risk and specific work characteristics that contribute to the risk. Such insight will be valuable for preparedness to threat in future pandemics. Second, the impact of COVID-19 and change in how, where, and when we work and the consequences for workers' health, especially mental health. The pandemic has strongly accelerated trends of already existing macroeconomic changes, and there is a need for both occupational health professionals and policymakers to adapt to this acceleration. Third and finally, the impact of the pandemic on social inequality. This is a great concern of vulnerable groups are disproportionately affected, and their working conditions cannot be isolated for poor social, economic and living conditions. Though return to work and compensation are other priorities, it raised the importance of our occupational specialty in this time of COVID-19. That's all, folks, and see you next month for a new episode of Newsroom.